After breast augmentation, if stroke when you develop capsular contracture, why is it a bigger procedure than the original surgery? Yeah, so that's the other thing. If you're thinking of having implants, as I say, I wouldn't say to you they're going to last forever. I would say to you that they may well need to be changed in the future. And if they do need to be changed in the future, it's likely to be a bigger operation and actually quite a bit, I think, more expensive than the original operation, simply because the capsule is scar tissue that forms around the implant. And it forms like a shell around the implant. It's a natural thing. It happens with any implant. So if you have a hip replacement, if you have an aortic valve replacement, if you have cataract, if you have any kind of implant inside your body will wall it off in scar tissue. And that's a natural thing to happen. If you get shot and you get a bullet, or if you get a bit of shrapnel, your body's going to wall it off in scar tissue, and that's called a capsule. So that capsule forms around the implant. So when you have your implant changed 10, 15, 20 years down the line, what we'll often do is we will remove that capsule. So if you're having the implant changed early on, for whatever reason, you usually don't have to do anything with the capsule, and that's actually quite an easy operation. Just changing implants is quite easy, taking a set out, putting a set back in. The difficulty comes when you have to take the capsule out, and that's called a capsulectomy. So if you have to do a capsulectomy, so if that scar tissue's gone really hard and you think, crikey, that's really hard, I don't want to put another implant in, because you'll feel that scar tissue. Because the problem, when an implant goes hard, inverted commas, the implant feels rock hard. But then you take you do the surgery, you take the implant out. The implant's not hard at all. The implant is absolutely fine. The reason it's hard is because that scar tissue has grown around the implant, as I say, which it always does. But over the years, it contracts, and as it contracts, it makes that implant inside it feel like a cricket ball. As soon as you open the capsule, take the implant out, it deflates, and the implant itself is not actually hard. It's your body's reaction to it. It's the scar tissue that's contracted over the years around the implant that's made it feel like a cricket ball. So you when you have a capsular contracture, you often want to do a capsulectomy, which is removing that capsule. But that doesn't come out easy. That capsule is kind of integrated with the breast tissue, and usually most people who have breast implants haven't got a huge amount of breast tissue, because that's kind of why they're having breast implants. So you've got to be really careful when you remove that capsule that you don't take away too much breast tissue. So you've got to make sure you have the interface between the capsule and the breast tissue, and you've got to try to sort of cut it out, trying to chisel it out bit by bit. So when you put an implant in, it takes about an hour. When you do a capsulectomy and change of implants, it takes about 3 hours. So it's a much bigger operation having a capsulectomy and change of implants than having the initial breast augmentation, because you have that capsulectomy. As I say, if you don't have a capsulectomy, it's not a big op at all. It's relatively straightforward. And sometimes if you don't need a capsulectomy, or you don't have a capsulectomy, we do something called a capsulotomy, which basically means we kind of score the capsule to kind of accommodate the new implant. So that's for someone who hasn't got a hard capsule around the implant. So if the implant hasn't gone hard and the scar tissue's not sort of gone hard, then you can do a capsulotomy, which is just scoring it, and kind of like checkerboard, scoring it on the anterior surface, and circumferential capsulotomy to try to release it and accommodate the new implant. Because doing work on the capsule does make it a bigger procedure than the original faux